Hello, I'm Shweta and I'm a physiotherapist from the Hounslow Adult Learning Disability Health team. Today, I'm going to talk to you about basics of postural care. First of all, let's understand what is posture. Posture is the position of your body when you're lying, sitting, standing, or moving over a 24-hour period. Posture affects your body shape. Postural care is important when someone can't move their bodies very well. Postural care is an approach that aims to prevent and restore body shape and muscle tone for people with movement difficulties. Postural care involves a personalized 24-hour program which addresses the postural needs of an individual and may include, but it's not limited to, adaptive seating, nighttime positioning, standing equipment, or a moving and handling plan. Let's talk about benefits of posture management. It helps avoid muscle and posture changes, helps avoid acute or chronic pain, helps internal body systems to function as best as they can, improves quality of life, increases comfort, improves daily functioning and participation. What to look for when someone's sitting in your wheelchair to ensure that they're comfortable? Firstly, look at the head. Ensure that it's well supported by the headrest if someone's got a reduced head control. The armrests should be at correct height, not too high or not too low. Backrest has to be in contact with the body and make sure that there's no gap between the low back and the backrest. The chest needs to be supported by the chest laterals or the seat contoured as per chest shape. Make sure that the person is not leaning or rotating out of the chair. Pelvis and thighs need to be well supported either by the standard or the special seat. Make sure that the person's not sliding forward or the legs are not swaying to one side and they're sitting in a position as prescribed by your wheelchair therapist. Make sure the feet are supported and they're not dangling or out of the foot plate. What would you look for when someone is lying? Ensure they have a good supporting surface, appropriate mattress, and they're well supported and comfortable. Ensure even pressure distribution, which means that they're lying flat on the surface, and avoid point loading under a specific body part. Make sure they have a good alignment in lying. Example, avoid lying in a crunched position in side lying or lying with knees curled to chest or legs swaying to one side. Ensure good supports with pillows or the prescribed sleep system. Try to position in a near normal position as possible. If you're using a sleep system, please follow the guidelines provided by a healthcare professional. If not using a sleep system, avoid positions that leave you stuck, stiff, or sore. Reminders for safe standing. Use appropriate equipment as advised, example walking aids, standing frames, special standing slings, or even one-to-one support if that's appropriate. Make sure that you've risk assessed the task. Follow the guidelines provided by a physiotherapist and use appropriate footwear and splints as they have been prescribed. Talking about safe mobility. Again, use appropriate equipment such as walking stick or a Zimmer frame, a special walking frame, or one-to-one support as required. Use well-fitted footwear and splints as prescribed. Follow the walking and transfer guidelines provided by a physiotherapist. Please ensure that you don't walk with socks or tights on hard floors as it may lead to slip and fall. The tips that we just discussed about postural management may seem simple and obvious, but if not followed, it may lead to serious problems. Let's discuss some problems associated with body shape distortion due to poor postural care. It could lead to respiratory problems, physical problems such as hip dislocation, contractures, curvature of spine or reduced movement, swallowing difficulty and risk of choking, constipation, recurrent pressure sores, pressure on internal organs, and lastly but not least, severe pain and fatigue. A reminder, if any of the above problems already exist, please follow individual care plans in addition to posture management plan. Given the current COVID crisis, I'm going to talk a bit more about the respiratory problems. There are some risk factors for respiratory problems. These are an airway clearance dysfunction, which is a difficulty clearing secretions, saliva management difficulties, immobility, reflux, sleep disordered breathing, and a thoracic deformity. It is important to know that all these factors can be reduced by good postural management, which will thereby prevent respiratory problems. Good posture and good positioning of thorax is the key to avoid respiratory problems. Please ensure that the person is not leaning to one side or slumped, as this can lead to change in air entry into the lungs and breathing difficulty. When lying, please ensure that the spine is as straight as possible so that the chest is in a good shape. Please use appropriate support sleep system as prescribed if there is a curvature of spine. Sleep in a position as advised by a healthcare professional. Please ensure there's no twisting at the spine, hips. And just as a reminder, if you notice deterioration in respiratory health, such as difficulty breathing, talking, feeling confused, more tired, please contact GP or NHS 111. For any emergencies, contact 999 as you may be aware as per the care plan. I have discussed a very much basic level of posture management so that you remember the important points for consideration. Please follow these simple steps to prevent any serious problems. And of course, you can always contact your physiotherapist. If the person you're caring for complains of physical pain or discomfort which may relate it to their positioning, has pain or swelling in any of the joints or muscles, if input is required for respiratory health such as chest PT or positioning, if you observe any redness on any part of the body or if a pressure sore is observed, exercise program is required or if training carers for exercises is required, if you need review of current positioning or standing equipment as you feel they are not supported well, if assistance is required around mobility, transfers, frequent falls, or if you have any other query related to their physical health. Please be safe. Thank you.